Hi guys, it's Dr. McJunkin and I have a special guest, Lauren, today.
Hi everybody.
I work with Lauren and I've worked with her for a couple of years now, I guess. Well, here we are. Okay, it's Dr. McJunkin and Lauren. Lauren and I have worked together for the last few years. Today we're going to talk about Axonics technology, sacral neuromodulation technology, and that's what both of us kind of specialize in. I specialize in that as a physician, and that's the way I help to improve people's quality of life. And Lauren works for the company Axonics. And Lauren, why don't you tell us just a little bit what you do for Axonics?
Yeah, so I'm a clinical specialist, so I pre-op the patients, ask them their baseline symptoms, and kind of go over how the therapy works for the patient. I'm also in the procedure with the patient, and I program them how they respond to the therapy. Afterwards, I follow up with them periodically to see how well they're doing.
Yeah, so Lauren is, I think half the success of this procedure is identifying the right person and then the kind of surgical placement of this. Even though it's not a big surgery, you still have to do it in the right way. And the other half is on the back end, and that's what Lauren does, is basically optimizing the therapy. Because each person, it's almost like each person has an individual fingerprint. Every person has just a little bit of electrical energy that their body will respond to differently. Is that what you've kind of seen, Lauren?
Absolutely. The therapy responds a little bit differently to every patient. So once you get the implant, we're able to basically narrow it down to how your body responds to the therapy and give you the best programs to help you with your symptoms.
Perfect. So today we are going to talk about the Artisan S&M study. It's a 2-year study, and this is the study that Axonics did. There's actually 2 different studies, but this is their big study. They did another study, so this is the big, it's kind of an international study, and it's mostly in America, but they also had some European sites. They also did a European study that's very, very similar. But I will talk about the results just very briefly with you so you understand kind of where this research and technology comes from and what the research has shown. I think I mentioned before that the research on this actually dates back about 100 years ago when they found that stimulating the particular nerves on dogs opened up their bladder and brain connection. It came out about 25 years ago in humans. And really in the past 4 years, the technology has been kind of almost perfected. And that's part of this study here, the Artisan study. So this study was a good size study. It had 129 people. It was multi-centered, like I mentioned, most of them in the US, although some of them were in Europe. And it's called a pivotal clinical study, and that means the study that they needed to prove that this works to bring it to the FDA. And then get it approved into people. And so what the study showed, I'm going to go over the highlights of this, and I'll actually put this in the notes as well. But 93% of the people who had the implant in the study were successful. Success was defined as more than 50% relief of their urinary incontinence symptoms. 75% of the people had reduction in the amount of episodes that they had of urinary incontinence. 82% had a reduction in their leakage, and then 37% of the people who had accidents were completely dry, so they no longer had any accidents at all. And so generally what we tell people is that this therapy works for about 93% of people, and you can expect about a 75% reduction in your symptoms. Now, some people get 100%, some people 85%, but the average person gets about 75%. Do you have anything to add in particular to that, Lauren?
I agree. I do believe that the therapy works. Like I was telling him earlier, I've been with the company for almost a year now, and I believe in it so much that I even recommended my grandmother to get it done. She has severe FI issues, and
which is fecal incontinence. So this technology works for bladder problems, but it's the same nerves that actually affect people who have bowel problems as well. And there's a lot of people. We think there's about 50 million people in the U.S. who have bladder problems, and somewhere around 20 million people that have bowel problems. And a lot of people have both of those. So her grandma had mostly the bowel issue. Is that right?
Yep.
Okay.
And she got done maybe 4 3 months ago now, and she has given the therapy 90% success rate. No more bowel leakage, no more getting up in the night, no more having to wear diapers or Depends. She also has MS, so she's limited with mobility, and she's able to make it to the restroom on time as well.
And her story was kind of interesting because her grandma had this problem since she was a little girl.
Yep.
When she was 13 years old, she's been struggling, and you guys can imagine, as an adult, it's hard enough to struggle with bladder or bowel problems. But as a 13-year-old child, I have a 14-year-old at home.
Yep.
As a 13-year-old child, that's a really, really hard thing to deal with. And so your grandma's really been dealing with that for most of her adult life.
Absolutely. And she's very, very with it, very mobile, very active. And so this literally gave her back the quality of life.
And tell me about so you were telling me about the transformation that you've kind of witnessed in her life. And you're obviously like a very close insider. You've known her, or she probably has known you your entire life.
Right.
And she's been a figure in your life your entire life. But what's that transformation been like for you to see?
It's, well, she's not as, she's more present, like at family functions. Like that's the big thing I've noticed, because typically she'll have to go use her walker to go to the restroom, and she's gone for a while. Now she's able to stay the whole time, and she loves it. Like it's just it's incredible.
Has that been like a peace of mind thing for her, where now she feels like she was out of control to some degree, now she feels like she's kind of more in control?
And she has other health issues, so she's constantly going to the doctor's office. So now she's able to go to all her doctor's appointments without having to worry about where's the nearest restroom and am I going to make it home in time.
Sure.
So that's been really helpful for her as well.
Okay, that makes sense.
Yeah,
I think that's an incredible testimony to the success of this. I'm going to talk a little bit more about the artisan study and what that showed. One of the things they look at is if you have a bowel or bladder problem, it drastically affects your quality of life, and your quality of life decreases dramatically. And so some of the things they look at is what you actually just mentioned is sleep becomes a problem for people. If they're up at night going to the bathroom, it's difficult to get back to sleep. When they get back to sleep, oftentimes they don't get that deep restorative sleep. Socially, this becomes difficult, and you said at family functions, which would be under that social category. It's really hard to have normal relationships when you're like, oh, I gotta go, or in the middle of a movie or dinner or family event. Coping skills, and so for any of us, when we have any health condition, oftentimes from a coping standpoint, we're like one more issue away from being at our limit. And also concern, and that's just like I'm always anxious and concerned that I'm not going to be able to get to where I need to go, and I'm going to have an accident. So they look at all of those things, and they put those things all into quality of life measurements. And what they found with this particular therapy and in this research study is research studies, they'll look to see a meaningful difference in quality of life is like a bump from that baseline up. And so what they found with this therapy, it actually bumps that up not only one time, which would be a meaningful difference for quality of life, not only 2 times, which would really make a huge difference, but 3 times for people. And so what that means is it's a dramatic improvement across all the different areas that we mentioned for quality of life. And what it means is those people are getting their life back. Okay, I'm going to mention another patient that we actually both just saw. So another real world example. And so this is one of the patients that we have. And so she actually had a stroke about 25 years ago. And unfortunately, with that, she became partially paralyzed. So she lost the use of most of the function in her legs and some of the function in her arms. And so one of the things that she struggles with is she struggles with overactive bladder and a bladder problem. And so during the day, she mostly is in an electric wheelchair if she goes out. But during the day, she's at home. She's disabled. And so she has to get from, her chair or her couch to the bathroom. And so for the most part during the day, she doesn't have quite as many accidents. But for her, the nighttime becomes a massive problem. And so she can't get into a wheelchair fast enough to get to the bathroom, and she obviously has accidents along the way. And her practice for the last several years has been to get out of bed and basically crawl like an army crawl, just pulling her body to try to get to the bathroom in time, and then struggle with that, and also, have accidents on the way. So she is, I think a real inspiration because she's a fighter. But she is somebody that we just used the technology on. But she is out, she tried it. I know there's 2 steps that I told you before called the trial. You try it out, see if it works for you. But number 2 is the implant procedure. So she is a couple weeks out of the implant procedure, and right now she has about 95% relief. And so for her, something like that will be life-changing for her, because during the day she's going to have a lot more control. She's going to be able to make it to the bathroom and not have accidents. And at nighttime, she no longer will have to crawl, and then she also shouldn't have falls. And that becomes a really significant risk if you're trying to transfer from your bed to a wheelchair or to a walker, and you fall over and have a hip fracture or something like that. And I know she's had a problem with falls in the past. Mm-hmm. So that's just a fresh example because it's today, but she's doing incredibly well. Back to the research study, the Artisan study. At 2 years, one of the things people always ask is, what are the risks of something like this procedure? And I'm going to ask you, Lauren, what if anyone asks you what are the risks? Let's say your grandma's should I do this or not? I know you encourage your grandma to do it.
Right.
But what do you say the risks are?
There are none. There are no adverse reactions. There are no risks. I mean, it's very... I'm not sure.
Okay, so you feel like the risks are very low.
Very low, yeah.
So what I tell people is a little different than that. So I, of course, I'm a physician, so we kind of, in the paperwork, when you sign any surgical procedure, basically you're signing the risk are everything: dying, allergic reactions to medicine, so on and so forth. But what I tell people, the risks are very minimal. Mm-hmm. But I tell people the risks usually fall under 3 categories: bleeding, so we don't want people on blood thinners generally. Infection is a risk factor. And for the trial, when you try it out, that's not as great a risk. But for the implant procedure, there's about a 1% risk of that. We take that pretty seriously, so people have to be on antibiotics for a few days. And then tissue trauma, and that's just as we go on with little needles, structures can get damaged. But to your point, in the kind of history of the world, there's been 200,000 of these devices that have been done. No one has ever been paralyzed, and the reason is because it's outside the spinal canal. And also there's never been any permanent nerve damage. And so I think those things make it incredibly safe. Yeah. Where I think you used to work in the past in the pain world, where they were doing injections and procedures right next to the spinal cord. Mm-hmm. And some of those have dramatically more risk than something like this.
Absolutely.
In the research study, what they showed at 2 years is there was a less than 1% risk of what we call lead migration. But basically, you pretend like this is the nerve. We want the little lead to sit next to it, and it uses electrical signals along that nerve. If that lead moves, then we can lose the coverage over this. So I think less than 1% is accurate. So far in our practice, I have seen 1 lead migration after somebody was in a pretty significant car accident. Yeah, but they were able to actually reprogram it. We had another lady who had a heart attack, and so they moved her all around in her body and this and that, and in and out of the hospital. And we looked at her lead, and it barely had moved. But again, that's something that they can use the technology to program around. But occasionally, if it moves too much, you might have to go back in surgically and put it in the right spot. The other, actually more common issue is a little less than 2% of people, so maybe 1 to 2 out of 100 people had some kind of uncomfortable sensation or pain where the little battery is. And I've showed you guys before, but the battery ends up being this big. It's not very big. It goes right under the skin. But for any of us, that can be a little bit uncomfortable. And if it's very uncomfortable, then sometimes we'll actually move that battery, and I certainly have had to do that a few times. But for the most part, most people do really, really well and tolerate it well. Do you have any other examples of patients that you wanted to mention? Oh, we talked about the one gentleman.
Oh, yeah. So I had a gentleman patient, Army history, golfing history, very active man growing up. And over time, obviously, his bladder was giving him some issues. He was going to the bathroom, kid you not, like 30 to 40 times a day, just bound from his recliner to the restroom. That was his whole day. And he was very unhappy. He found Dr. McJunkin, he did the procedure, and 2 weeks later I followed up with him, and from 30 times a day, he's going 10 times a day. And he has his quality of life back. He's able to go out and do things with his wife. He was so happy. He was actually in tears. It's very heartfelt.
So his problem was so severe that he basically did not want to leave the house.
Right, yeah, he was embarrassed.
He was embarrassed, and then he was kind of ornery to be around. He has a little bit of a pill because I think he didn't sleep well, didn't have a lot of confidence, and couldn't get out of the house. And so I think that really affected his outlook on life.
Yeah.
And so for him, you could not only, and that's what we see with this therapy, it's not only does it help out with the symptoms of a bladder or bowel problem, but really it's like a confidence of life and quality of life kind of builder.
Yeah, because if you go back to your study when it says like the whole concern thing, I mean, people with these issues, that's all you're thinking about, right? Like with my grandma, it's all she's thinking about. Where is the bathroom? When am I going next? Now she can sit at a family function and she can play with her great grandkids and she can play a board game and she doesn't have to worry about that urgency to go to the bathroom again.
Absolutely. Yeah, that's right. Yeah, we saw another lady today, and she is 89 years old and like just looks amazing. Is healthy. She plays like pickleball and all sorts of things. But she had a bladder problem that was bothering her, and so she, just got treated. But she also, all of us are concerned about our quality of life and how we can optimize it. And so she's a couple weeks out, but she's, already at 75, 80% relief, and just feels like she has control over herself, over her body. And she's like, yep, I gotta go. I'm going to 2 plays today and I'm doing this and that. Just a really, really active person. And she's not going to let this slow her down. And again, I think very, inspirational.
Oh, absolutely. Yeah, she looked gorgeous. Yeah. And she not only had bladder issues, she also had, bowel movement issues, and both have improved dramatically.
Yeah. Yep. That's right.
Yeah.
Yep. There's another gentleman that I think of who, actually we did a special on TV where they interviewed one of the patients. Her name's Julie. One of my first patients, and she did like remarkably well, and so she was interviewed on TV and I was there. But it was interesting because a gentleman who worked at the TV station, he was the one who kind of, adds in, slices up the thing and gets it ready for TV. So I don't know exactly, I have no idea what all that does, but that was his job. But he was like, oh my gosh, I've had a bladder problem ever since I've been a kid. And so he actually came in, we ended up treating him. And so he said one of the big things is now, so in the past he used to sit there during, I think, Suns games or Diamondbacks games, and they'd have to splice in commercials during breaks. And so, but he would be like, it was really tough to do my job because I was getting up like 20 times a day to go to the bathroom and I didn't know when a commercial would be. And so this guy was like, for the first time ever, I actually feel normal. And so he was a really fun person to take care of because he watched the TV thing and like was like, I need to do this, and then he did it, and it really changed his life. Okay, and then I'm going to look at just a little bit more on the study. So one of the things that they always track in research studies is how satisfied you are and how likely you are to recommend this therapy to your friend, and that's always kind of the best thing. So when it comes to this particular device, the one that we primarily use, there's 2 versions. The smallest, tiniest one is a rechargeable battery that you have to recharge usually every 6 to 9 months.
Yep.
And so 91% of people said charging was easy and they didn't have a problem with that. 94% of people said the frequency of charging was just fine and acceptable. And actually, when this study came out, you had to charge once a month, and they've improved the technology to now it's 6 to 9 months. But 94% of people said, if I have to do this once a month, no big deal, as long as it takes care of my issue. And so that number, I would imagine, would be even higher now with the newer technology. 94% of people were satisfied with the therapy. And then 93% of people would undergo the therapy again with the same results that they've had. So generally, that is the patient satisfaction really comes down to, does it really work or not? And the more satisfied people are, is the more likely that this technology is making a huge difference in people's quality of life. Do you have anything you want to say about that in particular, patient satisfaction?
I mean, I agree with you. I mean, it is very, very easy, the charging. I mean, I know people get really overwhelmed with like technology and all that kind of stuff. It's literally like a hockey puck that you just put over you. You watch TV for 45 minutes and you're done.
Yep.
Every 6-8 months.
They've done a really nice job with the technology to make it simple,
Very user-friendly.
user friendly. So I love that aspect of it too. Okay, perfect. I think that kind of is our whole show for the day. Do you guys have any questions at all? Oh, I see one comment. Rebecca, so glad I did get this procedure. Rebecca, we're so glad too. And yeah, you're amazing. Yeah. Good. If you guys have any other questions, any other comments, please leave them below. It's been fun having Lauren here. We'll have to do it again.
Yes, thank you for having me.
The fabulous Lauren. And I think I'll see you guys next week, but early Merry Christmas to you guys. And if you have any questions, comments, or want to talk about what has affected your quality of life, please leave all that in the comments below. Thank you guys.
Bye, guys.